move on to gallbladder. The first, so when it comes to gallbladder imaging, when the operator is doing these scans. Oh, another thing, real quick. So whenever the operator does these scans, right? It's just a little fact. The operator stands on the patient's left side, just like when we're doing the CS exams. Just because it's
Mhm.
easier. Only time, that's the convention. The only time the operator stands on the right side is when they're doing cardiac exams, and that's because the heart is on the left side. And if you stand on the left side, you're gonna be short-handed. It's just awkward. So during cardiac exam, the convention is to stand on the right side. For everything else, the operator stands on the patient's left side.
I thought we stood on the right side.
What's that?
Or I thought we stood on the right side.
On the
But
CS
actually,
exams?
I don't know. Maybe I was
Uh,
doing it wrong the whole time. Okay.
okay, then but in ultrasound, you stand on the left side. I thought during CS, we.
Well, I'm not sure. I just thought it was right, but I'm not. That's what I've been doing, I think. But
All right, so gallbladder. So when the operator is doing a gallbladder exam, these are the things that he's or she's looking for. So he's looking for cholelithiasis, gallstones. He's looking for a positive or negative sonographic Murphy sign. This is the checklist that an operator has to go through. Gallbladder wall thickening, pericholecystic fluid, or common bile duct dilation. Now, we're just going to go through like normal anatomy. So one thing that I want you to take heed is this. You see this main liver fissure that separates the liver into right and left lobes, right? Just take note that the gallbladder is to the left of that main liver fissure because it's going to come into handy later when we look at some gallbladder images. So the gallbladder is on the left of it. And one more thing, in the gallbladder, the most lowest or inferior portion and the most anterior portion is the fundus. That's this right here. That's the tip, the most inferior part. And then you have the body and you have the neck. So the most inferior and anterior portion is the fundus. So just remember those two things. And then next, same thing here. And then just know what structures are around that area. And this is like kind of like not normal because like I said, how the gallbladder normally looks is like one of those like sunflowers that hasn't gotten a lot of sun. It just looks like stooped, like
looks sad.
yeah, sad. But in this one, it looks like all tall. It's not.
Direct.
I think they're like, how like they use the probe to kind of like lift structure stuff. I think that's what they're doing here. But it's like you can even see a bend. It's supposed to like hang down like this. But other than that, just know the normal structure. So you have the portal triad, and then you have the inferior vena cava. And so these are the normal things that are usually in that area. And so just remember that. And okay, so now we're going into exams. Whenever you're looking at an image, right? Always like try to, this is the trick that I use, like whenever you're imaging an area, just remember in your head, try to think in your head, what are the biggest structures? What are the most obvious structures in that area? And try to find those one at a time. So anyways, this is like as I went through how to do the sagittal planes towards the beginning. So that's what they're doing here. So for a gallbladder, they're gonna go along the inferior coast of the ribs, and it kind of helps to tell the patient take a deep breath in because the gallbladder is kind of like under the ribs, right? So if you ask them to take a deep breath in, it kind of pushes it down and makes it easier to scan it. So if you tell the patient to take a breath in, and then you're just gonna try to get sagittal scans, right? So you place a transducer as this person is doing, and then you move it right or left until you see the gallbladder in profile. So if you're trying to see the gallbladder in profile, and what I mean is profile, you see this entire length like this is going to be the plane. So if they ever give you an image of a gallbladder where you can see the whole thing, you can see the fundus, body, neck, it was not most likely, it was a longitudinal plane, more specifically a sagittal plane, because they're putting the transducer in a right on top of the gallbladder. How the gallbladder hangs down. It's just putting it right along it, in parallel to it. So when you put the transducer parallel to something, you get a profile view.
Mm-hmm.
Okay. Now with I'm gonna give you a little trick, right? It's gonna help you out. So as you can see, this is the liver. They give you a little anatomic landmark or reference. So this is the liver, the orange or pink. Now, in a sagittal plane, the gallbladder and the portal vein makes an exclamation point. So the gallbladder is here, and then the
Mm-hmm.
portal vein is here, and what's between is that main liver fissure. That's why I told you to take heed of that main liver fissure. So on a sagittal plane of the gallbladder and the portal vein looks like an exclamation point. So
Right.
I'm gonna go back real quick. So you see this right here. So if they're looking at this gallbladder in profile and it's a sagittal view, and if it's tilted the right way, the gallbladder sits here and portal vein is somewhere here. So it kind of looks like an exclamation point. Does it make sense?
How would I see portal vein like that if it was the
Okay,
transducer
this is the
was
portal vein
sagittal? Or portal track. What was it in the?
right here, right? Portal vein.
Yeah.
So if it's putting the transducer along here, right? And it's kind of like
Right.
if you kind of like angle it, so
Mm-hmm.
you're gonna see the gallbladder first. Where is it
Right.
at? Right? And then because let's look at the transducer marker. This is superior, right? This is inferior. This
Yeah.
is anterior, and this is posterior.
Mm-hmm.
So you're gonna see the like the fundus, obviously the most inferior anterior part, and then deeper to it and more medial to it, a little bit medial to it. I think he's angling the transducer too a little bit towards the lateral side, because
Mm-hmm.
otherwise you wouldn't see the fissure, right? So he's kind of angling it, and in that view, you have the gallbladder, and next you have the fissure, and then past the fissure is the portal vein. But it makes this exclamation point, and this
Mm-hmm.
dot is the portal vein, and this is the inferior vena cava.
Right.
Okay. Next, we have, okay, it's a zoomed in picture, same thing, gallbladder, main liver fissure, portal vein, and IVC. Another thing I'm gonna mention, and it's gonna probably be the answer to a lot of your anxiety, is that that transducer, right? It has like I said, the sound, the strength of the sound wave or the frequency, it wears down as it goes deeper and deeper, right? So it has an optimal area. It has a focus area where it gets like perfect resolution. As it gets deeper and as that sound wave loses its frequency and strength, it it loses resolution. And what happens when you lose resolution as it goes towards deeper, it brings back signal, but it's not really good at delineating the resolution. So sometimes as you get deeper, you'll see the portal vein and the IVC and the kidneys like all smushed up like towards the bottom, like right next to each other. And you're like, well, those things are not that close to each other. But that's because of the transducer. As it gets deeper, it loses resolution. So sometimes on the deeper end, stuff looks a lot closer to each other. But that's because that's just the way the transducer functions. Does that make sense?
Mm-hmm.
Like you'll see like where you'll see like a gallbladder and you'll see a liver and you pour it and you'll see like a kidney right here and you're like, well, the kidney's not that close, but that's because as it gets deeper, as it tries to get signal from deeper end of the anatomy, it loses resolution, and when it loses resolution, it it's hard for it to delineate like where the actual landmark is. And then I think like this is what I was talking about. Can you see that this is the lip fissure, right?
Yeah.
This is the gallbladder and the portal veins here. So you can see how it would make that exclamation point, right?
I can see if like yeah, if you like put the transducer in that certain angle and position, but like If I was just in a straight sagittal view,
Okay, yeah.
it
So
wouldn't make sense to me.
yeah, so like I said, it's trying to get a profile view of the gallbladder, right?
Yeah.
Because I know a straight sagittal is like this,
Yeah, exactly.
but for a gallbladder, if I did that, it would be a transverse cut, right, of the gallbladder. I know
Yeah.
on the actual
Or
body, I know on the actual body, this is like a true sagittal. But think about for
mhm.
the gallbladder, like if I'm going like this, straight, I'm cutting this. I'm getting a transverse view,
Yeah, that's what I'm
right? So
thinking.
if I'm trying to get like a sagittal view, that's what we do in MRI. Like if we're scanning the gallbladder, we're gonna plan the slices this way.
Hmm.
You get what I'm saying? And if I'm trying to get coronal, I'm gonna go on the side, on the lateral side, like where's that thing at? Da, 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 da. This guy. I'm also gonna try to like not make it a perfect straight line. I'm gonna
Hmm.
angle it to the point where I'm in line with the gallbladder because my goal is not to get perfect sagittal cuts. I'm trying to get like those sagittal coronal axial cuts of the gallbladder, right?
Okay, yeah. Hmm.
So yeah, they're putting the transducer like this,
Okay.
and then that's how it show up.
Hmm.
Um, okay, so like I was saying, right? This is a transverse view. So in the transverse view of the gallbladder, all you see is a circle. Okay, so you see what I'm talking about, Kenny? You
Yeah.
think if they did that exactly, it wouldn't have been a circle like that, right? They kind of angled it in a certain way to get a profile axial. Does that
To
make
get a
sense?
profile axiom?
Like okay, right here, they did it like this, right?
Hmm.
It wasn't like a true axial like this, because then,
Why not?
because because okay, they use that axial view to measure the wall thickness, right?
Hmm.
But if I'm
Okay.
cutting it like this, it's gonna be distorted. I'm not gonna get an accurate
Right.
measurement. So
Right.
I'm gonna go like this,
Hmm.
right? Because then it's gonna be look how perfect this circle is. If they angled it the way like a true axial, this side would be a little bit thicker. This side would be a little bit thinner.
Yeah.
You know what I'm saying? They're going
Hmm.
along the actual anatomy of the gallbladder. Hold on, let me
I
plug
mean, like
my.
their axis is on the gallbladder, not the body, basically.
Exactly, bro. Exactly. Like whenever we're doing MRIs, or we're doing brains or whatever, we're not just going perfect axials. We're angling. Like for example, if I'm doing, let's see, if I'm like doing the forearm and I'm doing axials, I go perpendicular to the bone.
Right. Right.
If I'm doing sagittal, I plan the slices parallel to the bone. I don't
Right.
just because the fore if I don't just go like along the forearm of this how the
Yeah.
skin is.
Like, also
Even like
mhm.
even like if I'm doing let's see what's a structure that's like angled. I think something. Uh, Usually everything is pretty easy. Like if I think of something,
Right.
I'll let you know. Okay, so that's what we're getting. See, it's good to have you here, Kenny, because like you're asking like good questions, clearing
I'm
things
not.
up for people, you know.
This is what I do.
Yeah. So this okay. This is the view that they use to check the wall thickness. Because remember, one of the signs of cholecystitis is uh like the increased wall thickness, right? This is the view that they're gonna use
Uh-huh.
to see how thick the wall is.
So
Okay.
how thick is this wall?
So on this one, nice, good question. Okay, so what is this? What is this like bright area right here, Kenny?
That is enhancement,
Right, acoustic
acoustic
enhancement most likely.
enhancement.
But the wall is just this like thin area right here. Very thin
Hmm.
wall. As you see where the black ends pretty much.
Yeah.
Very thin, right?
Yeah.
Not you can't really see a true wall. You just see like okay, the anechoic signal ends and it's like a nice like you can't even see it. But when
Mhm.
it's like an actual cholecystitis, you see this thick rim, which is totally abnormal if this is normal. Okay,
Mhm.
next. So now that was where we're here, right? A
Mhm.
transverse cut of the gallbladder. Now, do you know what the porta hepatis is, Kenny?
Porta hepatis?
Yep.
No.
It's this connective tissue area to the inferior portion of the liver where you have your portal triads entering.
Okay.
Yeah, I mean,
Okay, I heard
you
of
get what
that.
I'm saying? Where everything
Yeah,
is
what about it?
entering, where the hepatic artery. As a
Mm-hmm.
matter of fact, let me Google it so I don't teach people the wrong thing. Porta hepatis, deep fissure in the interior surface of the liver through which all the neurovascular structures except the hepatic veins and hepatic ducts enter or leave the liver. So yeah, so it's this area. So
Mm-hmm.
um, now we did axial images or transverse images of the gallbladder, right? We want to
Right.
look at do a thorough exam. We want to look at this cystic duct, portal vein, this area, right? Let's say
Mm-hmm.
we bring the transducer here along this way. Okay, we're not here anymore. Got it,
Right.
Kenny? We're here.
Mm-hmm.
Okay, so in that area, I'm gonna teach you another um, little tool. Okay, so it makes a Mickey Mouse basically. So the portal vein is the face of the Mickey Mouse. This is the hepatic artery. This is the common bile duct. Always, if you are doing a transverse cut of the porta hepatis, look for the Mickey Mouse. The face is a portal vein, and then this is the hepatic artery. This is the common bile duct. Got it?
Hold up. Let me just look at this.
Look at it.
Okay.
I'm gonna get a sip of my coffee. Do that.
All right.
And then
But is this
what?
like, are we always gonna get this view though? Like I feel like
If you go to the
it's not
porta
always gonna be a
hepatis,
Mickey Mouse.
if you go to the porta hepatis where those three structures are, it's gonna be a Mickey Mouse because it's not like the hepatic artery is in the front or to the anterior portion of the portal vein at one point and then it courses down and it's no, it's gonna stay anterior to the portal vein. Common bile duct is gonna stay in that relation to the hepatic artery in that specific area.
Mhm.
I mean, you're not gonna be looking like when I say porta hepatis, I'm talking about a specific area that you're scanning through. It's not gonna be
Yeah.
like that if you go because the portal vein is coming from more medial side. If they're coming from different areas, but if you're looking at scanning at the porta hepatis, which is this area, it's gonna
Mhm.
make that Mickey Mouse.
Okay.
You know what I'm saying? If you're scanning here, this area.
Uh-huh.
Now, what else is in that area?
Are you asking me?
Yeah, like what other normal anatomical structures, vessels, like specifically? Because remember how I said, whenever you look at an ultrasound, just like once you figure out where you are, just think like, okay, what else is in the area, and then you start crossing one out. So we already crossed out common bile duct, hepatic artery, and portal vein, right? So
Mm-hmm.
what's left around that area?
I don't know, man. I need to study for this.
No, no worries, man. Um,
Didn't think
would
this was it.
the would the
Are you talking
aorta
about the
be all the way
IVC?
over there?
Huh?
Would the aorta be over there?
Oh no. Are you talking
No,
about the
right?
IVC right there?
Yeah, the inferior vena cava would be there, right?
Mm-hmm.
Okay, this is what I was saying. Look where the kidney is. You see how close the kidney is right here to the liver and the gallbladder?
Oh, K is for kidney.
Yeah,
Oh,
the
I didn't.
K, yeah.
Okay.
It shouldn't be there, right? This is that you lose your resolution. That's why.
Mm-hmm.
Because the kidney is no way that close, right? You lose your
K is for
resolution
kidney.
and the signal gets deeper.
Okay.
And this is the gallbladder.
Right.
Does that make sense to you now? Did anything that I need to clear up?
No, I think you did.
Okay, what view is this again?
What's that? What
What?
view?
Yeah.
I'm cheating, man. I see it in the thing. It says transverse plane.
Okay, now if you tell me why is it transverse plane?
Because I see Mickey Mouse
And then how is the transducer placed?
in a axial view.
Yeah, exactly. All right. Next, I'm just gonna touch on lightly Doppler flow, and then I'll talk about it more when it comes up. So Doppler flow is basically. Do you know what Doppler flow is, Kenny?
I learned it once. I kind of know it.
Take a shot at it, cause.
It's like, I forgot if it's going away from you
Mm-hmm.
or something. If it's going away from you, I think the frequency is less when it comes back. And if you're coming
Exactly.
or something like that.
So,
I don't know.
like if an ambulance is coming towards you, the frequency
Mm.
of sound coming from the siren is gonna be higher
Yeah.
as opposed to an ambulance going away from you. The frequency of sound coming from that siren is gonna be less. The cops use the same method on the speed guns to see how fast you're going.
Mm.
They use Doppler
Mhm.
effect
Mhm.
to see how fast you're going. They're basically shooting sound waves off of your car and figuring out the frequency
Damn.
that comes back to see how fast you're going. So the transducer, it does the same thing to see if a blood is coming towards it or going away from it.
Mhm.
But the thing is, the transducer has to be perpendicular to the flow. Basically, like the way I think of it, like the think of the blood basically has to crush up against the transducer, which is not realistically possible. But what I'm trying to get at is if you put the transducer parallel to the flow, you're not gonna
Mm.
get a Doppler effect because the blood is just flowing underneath it. You
Right.
have to place it in a way where it's facing the blood flow.
Mm.
And the best way you can do that, like for deep vessels like this, it's hard because now everything is in parallel. You can kind of try to like tilt the transducer a little bit, get like 10 degrees of angle on it on soft tissue on top of it. That way
Mhm.
you kind of get some of the Doppler effect, but you can't really. But on the portal vein, I think there's an RE case. So this is the portal vein and the common bile duct. Everything's in profile here. So that would be a sagittal view, right? And then this is the anterior posterior transducer marker marked superior. So the transducer is towards the anterior side, but portal blood flow goes towards the anterior portion of the liver. That's why in the RE case, the portal blood flow comes up as a higher frequency. And then whatever color is up here, this is indicating flow towards the transducer or the higher frequency. So this, whatever color is on top, it indicates flow towards the transducer. So portal blood flow goes anteriorly
Yeah. The
as
color
opposed to,
marker,
what's up?
color map, the colors on the ultrasound don't. It's not even on the color map, man.
Yeah, because on right here,
Mhm.
it's more towards blue, right? Because
It's like
in
purple or
here,
something. Mhm.
one, you can't really get the transducer. Like I said, you have to get it perpendicular to the blood flow, and it's not possible here. Only way I would get true color, like dramatic difference, if the blood flowed upwards and another blood flow flew downwards. But in here, you're just gonna get mixed colors because the transducer is basically parallel to the blood flow.
Right.
Does that make sense? Oh shit! But in the
Mhm.
RE case, the portal blood, it goes like this and it flows up and it shows up red. But the hepatic vein blood flow, I explained this to, I think you went to Guru, where the portal, it brings the blood, right, and it kind of disperses it all across the liver, right?
Mhm.
In order to do that, it comes up and it goes anteriorly this way, this way, this way, right? And the hepatic vein, it does the opposite. It collects the blood from all of the liver and it takes it to the inferior vena cava, right? So the direction of blood flow for uh, the direction of blood flow for the hepatic vein is going posteriorly and then superiorly towards the inferior vena cava. So because in that case, because the transducer's position anteriorly, portal vein flow came up as higher frequency and portal hepatic vein flow came up as a lower frequency.
Mhm.
Make sense?
Yeah.
Okay. All right. Now we can talk about gallstones, cholelithiasis.